Welcome to the office. Welcome to the office, sir.
Thank you, sir.
How can I help you? You're coming from far,
Yeah.
right? You're visiting your son right now upstate,
Mm-hmm.
and but you're originally coming from India.
Yes.
Okay. Tell me what brings you here. Why did you come all the way down from Washington right now?
Pardon me?
Why are you here now? What's going on? Tell me, how can I help you, sir?
Actually, I have an issue with my back actually.
Okay.
I'm having the problem from here to this one, from here.
So neck and low back.
Yeah, neck and low back.
Number one is
These
what?
are low back.
Number one is the low back.
Yes.
It started when?
It is almost 10 years.
10 years. What happened 10 years ago?
10 years ago, actually, 11 years back, I got an incident actually. I lost my daughter.
I'm sorry.
At that time, I got a problem this one. After 2 years, I got this problem also.
Hold on. So 10 years ago, 11 years ago.
11 years ago, I got a problem actually. Incident, I lost my daughter, 16 years old.
Was it an accident or
No, there's some things.
something happened? Okay, I'm sorry to hear that.
Because of that, I've traveled a lot actually to Varanasi, and at that time I got this problem. It's a very severe problem.
Okay.
After that, I have taken some medicine and all, exercises, physiotherapy, and I've done.
So your hand is better now?
That time.
At that time?
That time.
Take,
That
okay?
time. After that, this one also started actually.
Low back
Low
start.
back also
With
started.
shooting pain down the right
Yeah,
leg?
right leg. I can't
How
stand
about
for,
the left?
even I can't walk for 200 meters, 250 meters. Again, I have to sit for some time.
Take it.
I can't
Okay.
stand for 2-3 minutes also. If I stand now, it will be pain.
Okay.
Because of pain. At night, this thing, I can't sleep properly.
So can you find a position of relief at night when you sleep or no?
No, night is more problem actually.
More pain at night, yes.
On work now, I can manage somewhat.
You're working right now?
Yeah, I'm working there.
Okay, you're doing physical work or
No,
computer work?
I'm a purchase manager actually.
Okay.
Supply chain manager.
So you're on the phone a lot.
Yeah, phone and system.
Emails, texts,
Yeah.
that stuff. Okay, I got it. Okay, now you've seen people for this? You've
Okay.
seen other doctors?
No, I have seen a lot of doctors. Actually, I went to Apollo. I have almost 5 times I have taken MRI.
And what is everyone telling you? Surgery?
They told me for surgery, but my son is not. They don't want actually.
Why you don't want surgery?
I don't know. Be a doctor's. They never
He's not giving assurance. Actually.
Nobody's
they
gonna
give
give
assurance, and on top of it,
Hold on. What are you saying? You're not getting an insurance?
And also-
they'll be like, oh, we can't totally give you an assurance that it's gonna be okay, and there is every probability that he might get paralyzed or something like that. So
Well, those are the realities, right?
Yeah.
And here's the reality. Maybe the research has changed. Now, here's the other thing. There's no doctor that can give you a guarantee for anything.
Not only that, actually, some of people have gone for surgery also. They have done also. After 2-3 years, again the same problem, some infection, something, again the same issue.
You're talking about back home in India or here?
In India,
back home, I mean, I think Dad is telling about his friend circle who got.
they got also
Surgery.
surgery operated actually surgery.
Yeah.
After 2 years, again they fell down actually. They have got some infections and all. Again they have to open and they have to do surgery. That's why I'm not comfort for that.
So number one is the sciatica coming from the low back. You don't have a history of a trauma-specific fall. You're saying it happened 2 years after your daughter passed away.
No.
Or you lost your daughter.
Yeah.
Sorry, I didn't mean to say that. Sorry, you lost your daughter. But the year after, you started getting this shooting pain.
Yes.
When did this come back? It's gone now, Mativa? It's fixed?
Now also problem is there.
Yeah, when did it come back?
Last 1 month I'm again suffering. Actually.
So all these years it's been okay?
No sir, oftenly it's coming.
On and off. What do
yes.
you do? Take
I'll take some physiotherapies and
Dawai?
I take rest.
Any
And
dawai?
Dawai also, I'm taking
Dawai you
some
have to-
vitamin tablets. Dawai I'm taking.
Take it. Okay. Okay.
I
What
lost
else?
my digestion system taking painkillers and all by after taking that.
And are you still taking painkillers
No
right
sir,
now?
now
Are you
I'm
on
very
any-
worried. I'm not taking. Only I'm using for my blood pressure tablets. That's it.
Okay, so that you're on blood pressure medication.
Yeah.
Take it. And what's your blood pressure typically?
Oh, now recently I've not checked anything actually.
How
But
long have you been on it?
this one is almost 15-20 years meditation.
From back home.
Yeah.
Okay. Okay. You ready to get started?
Yeah.
Is there anything else I need to know?
No. Actually, 2 years back I got some fracture here. That's it. Only one
Fracture.
Fracture.
Okay,
After
so
that,
don't shake your
they
hand.
Now it's okay. I'm fine now.
So don't shake your hand and start pop, 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 pop. I'm joking, guys. Let's go over your x-rays. Let's see mechanically what's going on with the body, okay?
That's
Come
fine.
over here, please. Okay, this is a picture in time. It tells us how you've evolved from birth, 24 bones in the spine, 23 discs in between. You're complaining of your low back, sciatica, going down the right side. Now, let's go, and you've heard me talk about this, right? In order to have a level base, or in order to have a stable building, we need a level base and foundation. And the foundation is the sacrum and the pelvis. Now, let's zoom in and let's look at the foundation. Sir. Okay, we got some fun stuff here. Deco. Can you see that there is asymmetry or imbalance in your foundation? Can you see the right leg is shorter than the left? It's tilting.
Yes.
Can you see this hole is different size from this hole? These are just x-ray projections. It doesn't mean it's bigger or smaller. It means that it's misaligned a very particular way. Can you see this hip joint here? And you can see this is a little bit, something's a little different here because of the weight distribution. Now, can you see this tailbone? Follow my cursor. Do you see how it bends there? So from here, it goes like this, then it goes like this, and then it goes like this. Do you see that? Tick? Alright. So we have a foundation issue, we have definitely a sacrum issue, but we also have this 5. Now, here's what I need you to see. This is your L5, sir. You have an old spina bifida, which means your sacrum was already malformed anyway. This is from birth. That's okay. I'm just showing you that if I touch this, it's going to be tender, even if there's no problem there. Okay? But here's what's happening now, sir. Deco. This is number 5. Your L5 is forming an accessory joint with the sacral ala of the sacrum here. It's trying to fuse together because it's been whatever this alignment issue. We'll look at the lateral in a second. Do you see that? Do you see that?
Mm-hmm.
Yeah? So you can see that L5 is wedged and tilting on the left side. You do see this, right? It's tilting that way. But more importantly is that space needs to open. It's trying to fuse here with your tailbone, the whole thing. So let's go to the side and see. This is your side profile, sir. And I mean, even just looking at your posture. And we're designed to have 60-degree curves. So the first thing is there's no curve here in your low back, number 1. Number 2 is you can see the neck is forward from the line here. So you have this anterior head carriage forward like this. All right, so we have, this is your low back, L5S1. Can you see okay there? You can see through good? Okay. This is the tailbone. You can see this nub here. This is an old tailbone injury right there. That's what's causing the tilt in your sacrum. But now what happened here? You have what's called a base posterior sacrum. Deco. You want the good news? I know how to deal with this. You know why? Because I got the same thing.
What?
I got the same thing.
Yeah.
One day I'll show everyone my x-rays.
Okay.
But in your scenario, whatever happened is this. Look. Yeah, this is the disc here, right? Yellow. Your sacrum is here.
Okay.
Your L5 is here.
Mm-hmm.
This needs to be here underneath. So we need to bring this whole tailbone underneath. But here's the kicker. But it's also part of our answer. This is not just a BP sacrum, base posterior, where you're going to contact S1. This is actually an S2 contact down here at this nub. And it's scooping it underneath the sacrum. This old pars fracture. You have an old bad injury. Something did happen. whether you remember it or whether you're telling me or not. You had
Actually.
you had a bad fall, dude.
Even 15, 20 years back, no, I fell down in my younger age. In scooter, fell down. Actually.
Yeah.
Maybe that time I didn't find any injury.
Yeah, but that time is you're young, you're active, you deal with it. You had it already going on, and then whatever life trauma, whatever happened, that triggered whatever it is. Here's some good news, and lots of actually good news. Your discs are L4 disc is good. 3. These are good discs. Okay? And even though this looks bad, you still got some disc in there. Okay? So we're okay there. Your discs are good in through here, sir. Let's go closer. These discs are great, dude. Now, let's figure out your neck. Because overall, you look, these discs are good. You can see this is an old whiplash. You had an old whiplash injury. Okay? Now, but the disc, even though it's a little bit, it's smaller than the rest, your discs are good. If you look at this, those are 20-year-old discs.
Yeah.
Giovanni. This is good. This is good. But what happened there? So let's go to the flexion extension and find out, then we're going to go to the numbers. Flexion and extension. In extension, they should all move back. In flexion, they should all move forward. Here's where we get a good answer. In flexion, look, this one went forward, forward, forward. That one didn't. That one is still tilting back, right? And so is this one. So your whole neck here is coming from C7T1, the base of your neck, which explains also this stuff here. Okay? But I'm showing you mechanically why. So C7T1 area we have down in the foundation. Now let's talk about this. Oh, we're going to have fun, sir. PI4EX5, rotated 1 millimeter sacrum on the left. I'm not so much concerned about a 1 millimeter rotation of the sacrum, but we know the lower is back. Here's the challenge, dude. And then I'm going to give you your answer today. Okay. You also have a left pelvis out. So you have a sacrum down here that's out and a pelvis that's out. You have a measured difference of 6 millimeters. So your right pelvis is 6 millimeters, or your right leg is 6 millimeters lower than your left. So you walk kind of off balance. I know he got the Hyderabadi wiggle. I know he got it. Okay? I have a few of them. Okay. So here's the jokes aside. So we have a PIEX. It's gone down and out. Down and out. This one is up. If I bring this up, this goes down, it makes your leg worse. So adjusting your pelvis is not your answer at all, anytime soon. The answer is in your tailbone. You can see there's a 2 millimeter difference between the right and left side of the tailbone. And that's part of the answer. So 2 millimeters of this 6 is coming from here, which is from your old tailbone injury. Okay? Did anyone explain that to you?
No.
Okay. So while you're here, there'll be lots of walking, lots of icing. Food, are you veg, non-veg?
Both.
Doesn't matter?
Doesn't matter.
Okay. If you can avoid any red meats while you're here, chicken is okay. No fish even for you. Just, if you need the chicken, if you need the animal protein, do some chicken, otherwise dal, sabzi, and all that
Fine.
stuff, please. Okay? Just for this week, because then we're not adding variables of inflammation. Okay, sir?
Fine.
Shall we get started?
Yeah.
Let's do this. Okay, so we're looking at the dimples. He's he works hard, dude. He's a hard worker, dude.
Yes.
I can tell. Right side's a little bit higher than the left, but overall, like you look at it, it doesn't look like there's anything wrong. It looks like fit, right? It looks pretty fit here. So he holds a lot of this pain inside. He just deals with it and has to suck it up. I get it. You have any other siblings?
I'm the only one.
You're the only one. Okay. Sir, can you walk to the nervous system poster, please? Walk over to the poster over there. There's that Hyderabadi wiggle, sir. Turn around. Watch his left side here. Shifts out to the left when he walks. Walk back and forth. Walk, please, straight. Walk to the nervous system poster.
Yeah.
March in place right here. March in place. Knees in front of you, sir. Not bend like this. Forward. There you go. Keep going. Close your eyes. You see how he wants to turn his whole body to that side? That's because the left pelvis is down and out and the short legs. So as he's doing it, he's going more and more like this.
No, this one is the main pain actually.
I understand. Have a seat, please. And let's get started. Starting at the base of the neck. Relax the shoulders. Head down. Now it's going to switch to the right. A lot of muscle tension left, goes to the right, breaks right. Very nice. He's had this for a long time. His body has compensated a lot over the years. Okay, so we have C7, T1, base of the neck. And he was saying because of all those fun painkillers, your digestion's all jacked up. Generally, though, you eat more veg, non-veg. Generally.
Non-veg.
More non-veg.
More meats, right?
More meat, yeah.
So I am going to need to give him something for his digestion to start. Something very simple, some acidifiers to break down those proteins. T6, left side, 5 points. And here's the fun one.
That is good for you.
Yeah. But it's lower than we think. Ye panche, sir. Dekho. Pain?
A little.
Now, here's what I want you to feel with me. This is my thumb, okay?
Okay.
That's 5. You feel this dip here?
Yeah.
Okay? This is S1.
Here is pain. Is the pain.
Okay, but let's go down even more. Yeah.
This one also pain.
More
Yeah.
than 1. This is 1. This is 2.
One is more.
This is 3. 3, 2, 1. It's a little bit lower, sir. Left side and right side. Anything shoot down your leg when I do that?
What do you mean?
Anything shooting down your leg when I do this?
No.
How about when I go this side?
No.
Okay, let's try this one more time, sir. Panch, 4, 5. 5. S1. I know that hurts. S2. S is here. S3, right there.
Here is more.
S3. Okay. Head down. Static palpation. Let's figure out this area here. And you can see, this is all swelling. That's all swelling. 1, 2, 3, 4, 5. Che ke sat. 6 is tender, yes? This one. But so is that. This one is more. Top?
No, top.
6. T6, S3. Now let's check the neck. I'm just feeling, I'm not thrusting, I'm not adjusting anything, I'm just feeling. 6, 6, 5, 6, 7, 1. 1. Starting at 1. T1, T6, S3. Those are the majors, sir. Okay. Do you understand what I went over on the x-ray, guys?
Yeah. This one is will affect in this one also, sir. This
What?
this pain.
Your jaw?
Yeah, just some.
That's all a result of the foundation, because remember, the x-ray, it looks like these are bad. But it's starting at where? T1. Now, this here, C5, the bone that looks smaller,
Yeah.
is affecting a little bit of that. but there's no pressure there.
Okay.
Okay? As I work on this, something may show up top. I don't know.
Yeah.
If something shows up in the upper cert, we deal with it. But I'm not just cracking it to crack it.
Yeah.
Okay?
Right.
Okay. Are you ready for me, sir?
Yeah.
You sure?
Yes.
Chalo. Now, I'm going to do T1 and T6, something different with him. And the reason why I'm doing 1 and 6 first is because once I do his low back, I don't want him sitting. I want him walking.
Yeah.
Okay? So T1 we're going to set as a PLS. Let's do T6 first. 1, 2, 3, 4, 5, 6. Hakro, 2, 3, 4, 5, 6. We'll see if anybody cut that. T6, PLS. Gotcha. Home run, brother. Breathe, sir. 1. Gotcha. Leave him for a second. You can just walk once and then come right back on the table. I just want to reset you. Take a nice deep breath in. Take, and let's go back. Now the fun one. Back over here. Now, so we know it's down on the right side. So the sacrum is doing this, right? It's tilting down. We need to be on S3. We're going to be down. We're going to torque to get some of that up at the same time. Lightly put your fingers on top. Light. Catch, don't push.
Okay.
Take. Oh. So we're coming down on the tissue, not up on the tissue. And the torque is going to be there. There. Sir, I need you to breathe and receive. That's a little bit. Wow. There you go. Okay, sir?
Okay.
Come off the table, please. Let's walk it off. I got more. Keep walking, please. Are you okay?
Yeah. Okay.
Take it. Let's go left side down. I got more. There's so much scar tissue in there that I got to chisel away at it, a few different angles. Let's see if we can jar a little more this way. Relax the shoulder there. Good. I need this up. There you go. A little more. Wow. That's a little. Come back up. One more over here, sir. He's gonna make us work. It's okay. You just slide up a little. There you go. Slide down a tiny bit. Sir, is that sharp there? Right there?
Yes.
Sharp, yeah? Step away. I'll tell you my thought process in a second. Have a seat, please, sir. All right, so here's my thought process. I'm bouncing off his spine.
Yeah.
Very rubbery. Something I had learned many years ago. And without getting into all the details, there's something hiding up top here. Because if we look now, come and look, I want you to see this. The neck should be clear at the bottom. Okay. Even that's better, but it's there a little bit. I'm not stressing over that. Check this out. Even that's better. But, देखो.
That's getting worse.
That's hiding. That's the old one.
No wonder he's having the jaw pain.
Left hand here. Okay. Just breathe, breathe, breathe. Breathe, sir, please. Let the elbow go down. Let it hang. Let this hang. Boss. There you go. Over here, sir. Have a seat. There's the rest. Sit up straight, please. Now let's see. You can come over here now. Yes. Left side down again, please, sir.
That one on the thing.
Let it roll. Let it come forward. Let your body hold come forward. Good. There's one. And last one. Sanskin, deep breath in. That's it. Walk it off, please. Walk it off back and forth. And have a seat, please. And let's recheck on the bottom now. So I'm starting on S3 is where I'm at in the low back. Take a deep breath. Let's see. Come back. All the way back. All the way back, sir. Don't be scared. Come back. Same? Different?
Different.
That's S1.
That one is the little problem.
Now, remember what I showed you on the x-ray? S1 is spina bifida. S1 is going to be tender regardless if there's a problem. Remember I showed you? That's S1. Deco, L5. That should be a little different right now. Punch. Ek, we already know S1 is spina bifida. We already know that's going to be tender. S2, this is the one we adjusted. There you go. Good. Cool. Now, let's do the buff and polish and get some of that scar tissue. I need you to focus on your breathing, sir. Deep breathing right now. In and out. Deep breaths, please. No pain when you breathe, right?
No.
Right hand in front. Now, let me just work on your right shoulder. Let me do the work, please. There you go. Great. Stand up and let's check the, squeeze the hand. Squeeze hard. Squeeze, squeeze. Squeeze my hand. Squeeze. Elbow. Radial head. Squeeze. Good. Okay, I'm working on your nose, your septum, okay? It's going to help you breathe better. Relax your feet up, boss. Hands on your belly button. You can come see close up with this one. So when I push here, sir, you feel this? I want you to feel the difference. This is stuck here. Do you feel that right there?
Yes.
This side is okay.
This one is little pain actually.
And chin down. Look down. More pain here. More pain here.
This side, right side.
Breathe through the mouth. Bas. That's it. Breathe in. Okay. And as you're walking, let me know, is there what's different? Is there anything different, sir? Doesn't matter good or bad, you can tell me more pain, less pain, this is now, whatever's different. If nothing is different, it's nothing.
The difference is there.
What's different for you right now?
This one, no, I used to feel pain here actually.
In the big toe.
Like, now little bit relief actually. But here, no, this one is little pain.
Sore.
This one from here.
Now remember, there's going to be some soreness.
Yeah.
There's going to be, okay? As much as I'm going to be able to get through that scar tissue to get to that fifth lumbar disc, fantastic. Squeeze my hand. Squeeze. Good. Zora Siddha. Squeeze. Good. Again, Zora. That's fine. One more. Still a little bit here on the inside. Us. Squeeze. We're all set for today?
Now I am standing here, no? This one, from here it will start pain actually. From here, no?
Mm-hmm.
That,
I understand.
main in this one. This one I can little bit manageable actually.
But
This
you
one-
understand the problem.
Sometimes what will happen, no? I have some board meetings and all, no? In all front of them, I can't sit for a long time. I have to go out, and that is actually it looks bad and all.
I understand. But you understand what I'm doing.
Yeah.
Okay, so we have a little process.
Yeah, I know. I've seen your the videos, a lot of
Okay.
videos actually.
There's a little process.
No issues. That's fine.
And as I said, I want you to make note also any changes, good or bad. You can tell me, my big toe feels better, but now my third toe is hurting.
Yeah.
Or my knee is starting to hurt behind. Any change is what I'm looking for to help
Yeah,
us.
100%.
Okay?
Sure.